Depression. It's almost 3 times more common for people with ADD, and there might be more you can do about it. Stay tuned. Science has really made a case for nutrition being a really good component to not just physical health, but mental health as well. This is G.H. Glade, and I am a practicing nurse practitioner in psychiatry, and I treat depression all the time, and I use conventional medications, but there's more to the picture, and supplements can play a vital role in really restoring a person's mood. And we're going to go through what I consider to be the top nutritional supplements in terms of addressing depression. ADD can really evoke depression. Sometimes if symptoms are really bad, it lends itself to anxiety, which dominoes into depression. And depression can get in the way of good nutrition. If you don't have the motivation or energy to fix a nutritious meal, then that gets in the way. The top supplement for me is fish oil, omega-3 fatty acids. Some time ago, the FDA came out with a recommendation for omega-3 fatty acids as a preventative for depression. And they didn't really have a good understanding at the time how things work. More and more disease processes are now being linked to inflammation. And we're talking not just the brain, but systemically through the body. We find that when people get depressed with any kind of depression, that we see all sorts of inflammatory markers go up. The aspect about omega-3 fatty acids is that they are a really good anti-inflammatory agent. Now, Harvard Medical School recommends doses between 1 gram and 10 grams. I like a minimum of 2 grams. And for people with bipolar disorder, you have to be a little careful because high doses of omega-3 fatty acids have been shown to evoke mania. The reality is I use conventional meds, and these are a complement. What you want to do is you want to have a good preparation with at least 60% EPA. And at the end of the video, I'm going to list all the dosage levels for what I call the Fab 5 of nutritional supplements for depression. For all you chefs out there, curcumin. It's found in turmeric, which is a lovely spice. It is a really helpful supplement for depression. Depression is linked to increased cortisol levels in the brain. And what we find is that it is found to increase levels of serotonin and norepinephrine. And these are vital neurotransmitters in terms of depression. It helps with that regulation of those neurotransmitters. A standard dosing is 500 milligrams twice per day. Now, some depression may be attributed to what is called oxidative stress. We burn energy, we use oxygen to do it, and what it does is it kicks off free radicals. Good old vitamin C. You know, it's been around forever, it's dirt cheap, and it tends to clean up those free radicals. There are lots and lots of studies that show that vitamin C is really helpful in terms of addressing depression. How much is enough? Well, I like 500 milligrams twice a day. There was a person some years ago, Linus Pauling, Nobel Prize winner, who really purported mega doses of vitamin C. And these were not helpful because the acidic quality would literally burn out the nephrons in people's kidneys. You know, reasonable dosing, 500 milligrams twice a day is a perfectly adequate dose to clean up all those free radicals and enough to address depression. We find that 70% of the US population is depleted on magnesium. Not unlike other supplements, we just can't get enough in our diet to give us what we need. Magnesium is really helpful in regulating sleep, and I take it myself as an adjunct to help me sleep better. Magnesium is one of those really important supplements that really has direct benefits in terms of depression. Now, how does this work? And it usually takes about 2 weeks for this to work. Magnesium is really good at reducing inflammatory proteins. Studies suggest that magnesium fights depression on a number of different levels, particularly if it is paired with calcium. And a simple Tums or a glass of milk will give you enough calcium for that pairing to happen. Now, what the pairing of magnesium and calcium do is they affect the glutamate pathway, and this disruption is really associated with depression. And in the notes, I'm going to list all the dosages for what I call the Fab 5 of nutritional supplements for depression. And I'm going to try and make this video not too sciencey, but just enough. But I'll also have references to overview literature for what I'm talking about, because I come from an evidence-based place in terms of the recommendations I make. Do you live in a gray climate? I do. Ain't no sunshine when it's gone, and it's gone a lot of the year. And one of the things that helps us make an important vitamin, vitamin D, is sunshine. Well, most of us work inside, and vitamin D3 is an important component in this regime of vitamins. There are stacks of literature that really point to the benefits of vitamin D in terms of mood regulation, and it's an important component in stabilizing your mood from a holistic perspective. Now, this has been G.H. Glade for Coaching ADD, and if this has been a useful video for you, thump that like button and share it, and I will catch you next week when I post another video. Take care.